One.
Good afternoon, everyone. Thank you all for joining us for this coffee hour. I have the pleasure of introducing a friend of ours who's been here as a presenter from times past, and we have also her son. Our presenter today for the coffee hour will be Martha Khlopin, and assisting her will be her son, Elliot Khlopin, who is the managing director of the company. And the company is called
Get2insurance.com.
Get2insurance.com. And so I'll give you background. Martha is a graduate of university, has been licensed general agent and registered partner since 1995. She hosts a weekly syndicated radio show entitled A Medicare Conversation with Martha and a Millennial. And is a guest each month on Living 808. I've seen her. That's a great show. Martha also conducts quarterly Medicare pre-retirement workshop for several companies and nonprofit groups throughout the island. Prior to transitioning to the healthcare industry, Martha worked as an assistant vice president for Bishop Trust Company and as a trust officer with First Hawaiian Bank. She's also former vice president with Morgan Stanley, Dean Witter Reynolds in Manhattan. Disclaimer is that this presentation to be provided as comprised of personal viewpoints of the speaker, and the HSBA has not approved of, nor does it endorse speaker recommendations. I believe you will fully enjoy what Martha has to say to us today. So without further ado, I introduce you Martha Khlopin, and Elliot will be coming and joining Mom.
Thank you so much, Gil.
Thank you.
Thank you so much for that introduction. Thank you, sir, for being here.
Would you like some thunderous applause?
Oh, I'm good. And Desmond, thank you so much for always setting things up and making everything just go so smoothly. And Gil, again, thank you so much. I'm so happy to have met you over 10 years ago. Wow, it's been 10 years and I've been doing this presentation for a good number of years. So today, my presentation, I generally start off taking that deep dive into Medicare and the basics, but this year I wanted to do something a little bit different because the headlines are getting a lot of attention as it relates to Social Security and Medicare. So I thought I would start with a little sizzle first. I do have my son, Elliot Khlopin, with me today. About 2 years ago, he joined Get2Insurance. That's our insurance agency. He runs it and I do all the education, radio, television. I do a lot of media work now. So he's taking care of all of our clients year round. And Elliot comes from Bank of Hawaii, where he worked for 4.5 years. He was working over in Kauai, managing a Bank of Hawaii branch. And then he decided to go back to get his MBA, which he graduates in May. And so he's definitely legacy and will be doing this insurance stuff for a long, long time. So I want to also let you know that I'm writing a book, and the book is called Turning 65 or Already There. What you don't know, you need to know about Medicare. Now, a lot of people ask me questions for the past dozen years, and it's so much that people don't know, but it's interesting. They don't know what they don't know. And so I said, let me start putting all of my different cases that I've worked on into a book, and I'll be making that available through Amazon in the next couple of months. Today, we're going to be talking about understanding Medicare enrollment periods and Medicare savings programs. But again, like I said, I wanted to start first by looking at some headlines. So disclaimer, as Gil said, nothing today is for any other purpose than educational. And thank you for honoring that for me. So what we're going to talk about today again are Medicare enrollment. What is Medicare enrollment? Well, Medicare enrollment is the way that people who qualify for Medicare get on a Medicare plan. When we're working and we have insurance through our employer, you know, you call HR or HR sends you a packet, and that's how you get into insurance. When you're born, sometimes you know, the family has insurance, you automatically get adopted into the family insurance plan. But when it's time for Medicare, that's something that you'll be doing on your own. But a lot of people don't realize that. There are people who sell Medicare insurance plans. So you can work with an agent to do that. But before you even talk to an agent, there are things you need to do with the Social Security system so you can pick up a Medicare plan. And that doesn't happen with any other type of insurance. where you have to reach out to a government agency, complete forms, enroll. So Medicare enrollment is a thing. Caregiver role, the reason I have that there, caregiver role, and I talk about social workers, most people don't know it's coming. Elliot, as a millennial, knows it's coming, but there may come a time in your life where you're taking care of Medicare, not for yourself, but maybe for a grandparent, a parent, an auntie, an uncle, even a brother or sister. A lot of people may not realize Medicare is not just for people who turn 65, but also people who have certain disabilities. So I believe everybody needs to be aware of exactly what Medicare is, exactly how it works, because at some point in time, you may become the social worker and provide caregiver role to help your loved ones with Medicare. The focus of the presentation will cover Medicare enrollment periods. People are very familiar with the one that's constantly advertised, annual enrollment period that sets up from October 15th to December 7th of every year. But there are other Medicare enrollment periods, and we're in one right now that runs through the end of the month. So everyone knows what Medicare is, right? Well, what is Medicare? Medicare is a federal health insurance program. It's run by the Centers for Medicare and Medicaid Services. Benefit decisions are controlled by the US Congress, and Social Security Administration handles enrollment and eligibility. The reason that I use this slide every time I do a presentation is because I've had so many people who, when they're ready to get enrolled in Medicare, they call 1-800-Medicare, they wait online, and then the Medicare rep says, you gotta call Social Security. So a lot of people do not realize that you actually enter through the gates to get to Medicare through Social Security and not Medicare. 1-800-Medicare is once you have Medicare, and then of course, if you have questions, that's who you would be talking to. So Medicare, some Medicare basics here. Medicare consists of multiple parts. Parts A, Part B, Part C, Part D. So Part A of Medicare takes care of hospital insurance, hospital services. Part B, medical insurance, that's your doctor visits, your outpatient care, your preventive services. Now, when you're in a commercial plan, when you're employed, you know, there's no breakdown of, well, this part of your health insurance is for hospital and this part of it. So a lot of people don't understand what are all these parts going on. And then when it's time to pick up a plan that will lower costs out of pocket, then you get to a Part C of Medicare. Medicare Part C is also known as Medicare Advantage plans offered by private insurance companies that have a contract with Medicare. Elliot, isn't it true? We get so many calls from people, they, you know, turn 65 or they leave their employer, they have to pick up a Medicare option and they pick up a Part C Medicare Advantage plan, but when they go to the doctor, they show their red, white, and blue Medicare card and that claim won't get paid. If you sign up for a Part C plan, that's the card that you have to use. You don't use your A and B card because your A and B is in the Part C. Part D is the prescription drug portion of a Medicare plan. Again, these are for medications that you pick up from a pharmacy. Some people have to pick up medication from that's covered under Part B. That would be injectables, transfusion. So that doesn't come under D because you don't pick it up from a pharmacy. So Part D of Medicare is strictly for drugs you pick up from a pharmacy. And a lot of people get confused by that as well. And then there's another type of plan that you can pick up that's offered by private insurance companies and totally separate from the Part C called Medicare Supplement Plan. So this is a plan where you would show your Medicare red, white, and blue card, Part A and Part B, and the supplement plan comes in on a secondary basis and covers what original Medicare does not. So a lot of people just get confused right there, but those are the Medicare basics, and that's what you need to know to have, in my opinion, the most successful journey in Medicare. So I wanted to look at today's headlines. I want to look at them because I don't know about you, Elliot, but I've gotten so many phone calls. People are forwarding me emails. People are asking me to watch videos because they're afraid that Medicare is going away, Social Security is going away. So I decided to pull a couple headlines myself. So this one says, concerns grow over high prior authorization rates and Medicare Advantage resulting in delayed care and unpaid bills. So people are now thinking, oh, I don't think I want that Medicare Advantage plan anymore because is not gonna pay my bills. Here's another one. Patient advocacy groups call for action on Medicare Advantage billing practices, citing mounting unpaid medical debt. And it's true, if you don't understand Medicare and you don't use the health insurance correctly, you could have big bills. One of the most common calls from this session that I've done in previous years is from solo practitioners. They're over 65 years old and they have employer coverage, but they never picked up Medicare because they talked to their friends and their friends said, oh, if you're working, I read that you don't have to pick up your Medicare Part B. So they didn't pick up the Medicare Part B, and then they have a bill come in that doesn't get paid. And they're thinking, I have insurance, why isn't it getting paid? It's not getting paid because if you're a solo practitioner and you don't have a multi-employer arrangement, or you pick up your insurance through a organization like Altrez or Pro Service, Medicare will pay primary. So even if you have employer coverage, it's secondary to Medicare. So if you don't pick up your Medicare A and B at age 65 and you're not covered under another plan that meets the requirement, Medicare's primary and your bills won't get paid. I just got off the phone with someone who called me and she said, Martha, she said, I was told to call you a few years ago, but I didn't. I just decided I was going to do my own thing. She said, my bills aren't getting paid. She said, I had a cancer diagnosis, I had surgery, and she said, my bills aren't getting paid. And I said, oh, how many people work at the company? Is it less than 20? She said, there's 5 of us. I said, do you have an arrangement with Altrez Pro Service exception? She said, no, the company owner writes a check to the insurance company every month. And I said, well, you were supposed to get your Medicare Part B at 65. And it's correct, your employer plan does not have to cover. So she's actually going to be out of pocket for a good amount of expenses. But I sent her those forms. That's what I was doing today. I sent her the forms. So starting April 1st, she will have Medicare Part B. And from that point forward, her bills will be paid first by Medicare, and then the employer plan will be secondary. But in terms of anything that she has had done prior to getting her Part B, her employer plan is not required to pay. Who's required to pay? She is. And I had a number of people, Gil, I can tell you from this group, they didn't want to believe me. They were like, no, you're wrong. And I was like, let's just call Medicare, please. And we call, and Medicare would say, yes, you are required if you don't meet, the test. And so someone actually said more than once, I called Social Security. I said to you, I'm turning 65, and you asked if I was still working, and I said yes, and they said all I needed was Part A. And I said, I would say to the person from this group, I said, but they did not ask you how many, the employer size. So you wouldn't know to tell them, and they didn't ask you, and that's how this didn't go so well. So they're very, very grateful to me. So I made a lot of friends in here at the, I have a lot of attorney friends now, and solo doctors too, and chiropractors and dentists. You'd be surprised how many people are unaware that once you turn 65, if you don't have a multi-employer arrangement, you're required to get Medicare A and B, both A and B, not just A, because Medicare will be primary. Any other insurance will be secondary. So hate to belabor that point. Next, I want to pull up some common claim errors. I know everybody is aware of a CEO of an insurance company who was actually, murdered by someone who said, hey, the insurance is not paying, it's causing a lot of problems. So I thought I would just pull up some things that are happening out there. Well, there are common claim errors. So when you hear people saying the claims didn't get paid, there could be a valid reason. And if you don't take care of the valid reason, that claim won't get paid. So I get calls from people all the time we get calls from people who say, my claim didn't get paid. And then we say, okay, let's send me the bill. And then we find out that the person presented the wrong card. The person, didn't present a card at all. Yesterday's meeting, you said, oh, you went to have this service. Did you show the card? And this person said to Elliot, my son came in, he took us to the doctor, and no, I didn't show any insurance card. I paid out of pocket. We're like, okay, but you have to show the correct card. Then the signature of the certifying physician, of course, has to be included on the claim forms. Now people sometimes are rushing through. That doesn't always happen. Also, documentation does not meet medical necessity. When you have Medicare, there are specific rules that have to be followed. So the rules for a commercial plan are not the same rules for a Medicare plan. So you may have been getting a certain treatment under your employer plan, everything's going well, you cross over to Medicare, not so well. It's because the doctor needs to be informed that you have different insurance and they might need to go and do a little bit more documentation. I had a case with a gentleman who was getting some hyperbaric treatment under his commercial plan, and he wanted to continue with. He crossed over to Medicare. Medicare doesn't cover hyperbaric treatment for his condition. So he was faced with no more treatment or pay $6,000 out of pocket. So his doctor found another way to help him with his situation, but he was so frustrated. I don't know if you remember back and forth with emails and phone calls, and he just said, Martha, how come they won't pay? It was paid 6 months ago when I had my employer plan. Go, yes, because Medicare is not an employer plan and it works differently. So a lot of people are unaware that the insurance rules are different between commercial plans and Medicare. So I'd like to share that. Encounter notes did not support all elements of eligibility. We're starting to see this with people who go for physical therapy. Physical therapy rules under Medicare changed January 2024. So if you were sailing along, getting your physical therapy, you need another bout of physical therapy, it works differently in 2025. So once again, your providers have to support and send that documentation, but they don't have the time. So that's why there's also a lot of problems that are coming up with how come these claims aren't being paid? Missing or incomplete initial certifications or recertification. I have some physicians in the family. I have one who just moved to Oklahoma, and he was supposed to start, I think February 1st. And so, you know, we would call and congratulate him, and he goes, oh, they haven't finished my credentialing. I'm like, I hope your job is not in jeopardy, but it took 2 months for him to get credentialed to be a physician in Oklahoma, because he was actually coming from Ohio. So again, if you know, people see patients and they don't have the right documentation, it's like anything else, it's not going to get approved. But individuals have no idea all of these things are going on in the backdrop. So we're so blessed, you know, our clients, we have a good relationship with them. And whenever they encounter anything, they just call us, and I'm on the phone. And I'm from the East Coast, so I've been in Hawaii for over 30 years. And I think I'm pretty, you know, easygoing and soft-spoken, except when I get on the phone about claim. Then the New York comes out and we're gonna get answers. We always do, don't we always get answers? We always do, as I won't let it go. So all of the complaining that people, I think have been making, I understand they should talk to their, I believe the politicians and tell them how unhappy they are. But look at this, according to available data, and this is true because I've gotten some letters I've shown you myself, since the recent investigations into Medicare Advantage billing practices, a significant number of plans have been terminated. Medicare Advantage plans have been terminated, with estimates suggesting around 20% of these Medicare Advantage contracts have been discontinued or significantly altered due to concerns over these improper billing practices. So all of this groundswell of concern and complaining, okay, so guess what? Those Medicare Advantage plans are going away, okay? And we met with some folks here locally who head up an insurance company, and they saw a couple of their plans ended on the neighbor islands, and now they have one plan on this island. And Ellie and I, we were saying, oh, you think they're gonna like leave the market altogether? So we don't know, but when I look at this, it's a possibility. So what does that mean? You're like, so who cares if a Medicare Advantage plan leaves? Well, we only have 8 Medicare Advantage plans on island, 8, okay? And if one leaves, okay, that leaves 7. But what if, you know, you like that plan that left? So if we're complaining and we don't know why, we don't really understand how Medicare works, it can create a situation where you'll only be left with a limited number of players in the market. So what happens if you don't have any Medicare Advantage plans? like in the state of Alaska. They don't have Medicare Advantage plans. They have original Medicare, A and B, pick up a Part D or do a supplement. What does that mean? When you have a Medicare Advantage plan, it lowers your cost out of pocket. A doctor visit might be $0 or $10. If you have no Medicare Advantage plan and you use original Medicare to see that doctor, you have a deductible. In 2025 is $257 annual deductible, and then you pay 20% of the cost of that physician visit. So if these Advantage plans start going away, and we just have original Medicare like Alaska, we will be paying more, people with Medicare will be paying more for their outpatient costs. But no one really thinks about that, but I do.
Any predictions on Akamai Advantage, whether they'll stay in the market, their HMSA's plan?
Yeah, what was the question?
Any predictions on whether Akamai Advantage is gonna remain in the market?
I believe that Akamai will remain in the market. I used to work for HMSA, and I was part of a team in 2010 that we launched Akamai Advantage. So I believe that because they've been around for so long, they know exactly, they know this market very well, and I think they'll be able to continue the plan. Correct, yes.
Thanks.
Okay, if someone you know or care for is turning 65, already there, or retiring and losing employer coverage, where do you go for help? So the Medicare system is a bit of a maze. There's no physical office. There's a physical Social Security office, but there's no physical Medicare office. So when it's time to work with Medicare, you're calling 1-800-Medicare. And even we have to do that when we need to work with them. Okay, when it's time to pick up that initial Medicare Part A and B, again, you work through the Social Security Administration. There used to be these nice waiting rooms and you could go in and sit and talk to someone. Now, Social Security encourages you to call them and make an appointment, and they'll call you back to enroll you. You do all that to get this insurance card. This is the red, white, and blue insurance card. A lot of folks, when we talk to them, they don't even know what, they're like, which card do I use when I go for treatment? So I said, well, it depends on the plan you have. Most people don't know that depending on the Medicare plan you choose, some people will show this card. If you pick up a Part C Medicare Advantage plan, do not show this card. Because if you show this card, all it will do is mess up your billing and you'll start getting bills that you think you have to pay for that you don't. But who tells you that? A lot of times people pick up a Medicare plan by going to a workshop or a seminar, or they have a friend who turns them on to an insurance agent. Nothing wrong with insurance agent. Elliot manages 5 insurance agents down at our office. But the Medicare sales agents, their job is to be Medicare sales agent. It's just like if you go and you buy a car and a salesperson generally will help you with that. But then once you have issues, you don't go back to the sales agent, to say, wait, how do I work this brake or something? That's another area. So it's the same thing. I think people don't realize when you go onto Medicare, it's a journey, and you are going to need somebody other than just a sales agent to really service you. So one of the things you should be looking for is this a company, when I call them, do they answer? Do they get back to me? Do they service me? That's important. This was another one. I didn't expect anybody to really see this as small print, but I couldn't resist this. When I talk about when you pick up a Medicare Advantage plan or a Medicare supplement plan, you need someone to service you, even in working with Medicare and Social Security. I believe we've all heard now that Social Security has announced workforce and organization changes. They're planning to cut staff. So if you have to go through Social Security to get Medicare, and now this is dated February 28th, and this is from Social Security, they're saying, consistent with recent executive orders issued by the White House, the Social Security Administration will continue to implement efficiencies and reduce costs with a renewed focus on mission critical work for the American people. But it says Social Security recently set a staffing target of 50,000, down from the current level of approximately 57,000 employees. So if you're going to reduce the staff at Social Security, where will you go for help? So I believe people really, really need to learn Social Security as it relates to Medicare. You really have to learn it, because If you don't, you're gonna go to an agent. That's not their job to sit and tell you how Social Security and Medicare works. It's their job to sell you a plan. So I'm happy that for 12 years, I've been, as a community service, really hand-holding and taking people through, the navigation of, everything Medicare. So when it's time to enroll in Medicare, you can enroll online, you can call Social Security to schedule a telephone appointment. If you're over 65, you will be required to prove you had employer coverage from the age of 65. And you will need to download some Social Security forms and complete them if you're over 65. And then I just wanted to give people a sample of what the forms look like, because I used to talk about them, L564, B40, but I decided for this presentation, I would enclose a sample of the Part B enrollment forms if you're 65 and older. So again, if you're under 65, you do not need to fill out these forms. You can make an appointment, or you can simply go to ssa.gov and do an online application. But if you're over 65, or if you're one of those solo practitioners that have been flying solo with employer coverage and no Medicare A and B, and you're less than 20 and you need it, these are the forms that you'll be filling out. You know, because if you don't pick up Medicare when you're supposed to, there are also penalties that may apply, and they are for a lifetime. Okay, so there's 4 parts of Medicare. We've talked about them before: hospital, doctor, Part C, and Part D drug coverage. Hospital, if you had just original Medicare Part A as an apple, no Advantage plan, you would have a deductible applied $1,676 for 2025, and you would pay that first before Medicare kicks in. For the Part B side, as I mentioned, $257 is the deductible, and your monthly amount is $185. I do put higher earners pay more because I have a couple and their income 2 years ago, because this is Medicare, they look at your income 2 years ago, and this couple, their income was over $750,000 2 years ago, 2023. So their premium is not $185. Their premium, they're paying about $570 each, something like that. So $1,140 for a couple, and they haven't even seen the doctor. But that is their Part B premium because their income is over $750,000. And that applies to an individual. Social Security is really good about checking with the IRS and looking at your modified adjusted gross income and sending you the bill, letting you know that your Part B is going to be more than $185. Part C plans can be as low as $0, and they can be 100, 113, you know, they could be more depending upon the plan. Medicare Advantage drug plans can be as low as $0 in our community this year, but every year those rates can change. Okay, Medicare options, I'd like to include this slide only for the purpose of reminding people, because so many people call me and I say, oh, what kind of Medicare plan do you have? And they say, oh, I have a Medicare supplement plan. And I said, oh, is it G, F, N? And they go, what are you talking about? I think it's a C. I go, oh, then that's a Medicare Advantage plan, not a Medicare supplement plan. So there's a distinct difference between a Medicare supplement plan and Advantage plan. Medicare supplement plan, you show your Part A and Part B card to your provider. You have to pick up a separate D for drugs, and then you use your Medicare supplement plan. Whatever A and B does not cover, your supplement plan picks up the difference after any small deductibles. On the Part C plan, and you can't have both at the same time, what you've done is you've taken your A and B, you've given it to the Part C plan. They get paid for you being enrolled in their plan. The plan will pay your bills. That's why you don't show the A and B card, because that plan, the Medicare Advantage plan, also known as Part C, which often includes your Part D, they will be paying your claims to the providers. So that's why it's important to know the difference, even when you're talking to someone. We had last year a new plan came to town, and they were offering a $5,000 dental benefit. So we had somebody on this supplement plan, and she said, I'm at the dentist, and they said that this $5,000 would be good. I need a lot of work. And she said, so I want to sign up for them. And I said, okay, so just know you'll be changing from a supplement to an Advantage. And supplement plans after a certain period are subject to underwriting. So you may not be able to get back to that plan. And she had no idea. She said she thought she was adding this Medicare Advantage plan onto her Medicare supplement. She didn't know you can't have both at the same time. So she ended up staying with the supplement and not doing that Advantage plan.
Another quick question.
Oh,
if I may.
sure. Oh, please.
If you have TRICARE for life,
Mhm.
do you need Part D prescription drug coverage?
Yes, if you have TRICARE for life, you do not need to pick up a Part D plan. You do not, because it's embedded.
And if you do have Part D, does that show up on your red, white, and blue card?
No, your Part D will never show on the red, white, and blue card. It will always be a separate card that says prescription RX and Part D at the top, yeah. All right, Medicare Advantage, the all-in-one solution. Again, Medicare A, B, D, and also they give you those extra benefits like a free gym membership and all those kinds of things. So people are very attracted to the Medicare Advantage plan. Now, people are asking me, is Medicare going away? Is Medicare Advantage going away? And what I would love to tell them, but I know they probably don't quite get it, is remember I said that Medicare pays the Medicare Advantage plan to deliver all your services. So if it's a possibility that under the current administration, they will lower what they're paying to the private insurance companies, that the core benefits aren't going anywhere. But these healthy extras is a possibility. Maybe they won't be able to give you as many extra benefits. So maybe the network for the free gym membership will change. Maybe the allowance for vision will change. Maybe the dental allowance will change. Maybe a zero plan will have a premium. But I would say Medicare is not going away. There's too many people with Medicare. There's over 300,000 in the state of Hawaii with Medicare, and nationally 65 million people with Medicare. By the year 2030, 80 million people will have Medicare. So I don't see it going away. I don't see it. But you have to know how it works. What is a Medigap plan? A Medigap plan, this has not parts, but plans. It has like plan A, plan G, plan F, plan N. So it's important to just know a Medigap plan is different from a Medicare Advantage. Now, pinpoint, I put this up just to remind me to stop, to say, what I think I'm hearing is people don't know how to find a trusted Medicare resource. Because let's face it, a person who is an agent, a sales agent, if that's how they make their living, they can't spend hours and hours and go to your house and sit for hours and have coffee. They have to keep signing up people to make a living marketing Advantage plans. So it's important to, have your, your go-to for all things Medicare. Make sure you have the Medicare, toll-free number, in your phone. Make sure you reach out to your, have your insurance agent to direct you to who to call at the insurance company. But you really need, in my opinion, to find trusted resources. So when you have an issue, you have somebody to call. Because generally when you just call a number and you don't even know what you're calling about, the person on the other end doesn't know what you're calling about. So you really need a trusted Medicare resource, in my opinion, to get through things. Here is a slide with very small print, but what it says is know who pays first. The reason I have this, and anybody that calls me, I always send it because they never believe me when I say, if you have retiree insurance, that's insurance from your employer, who pays first? Well, if you are 65 or older, have group health plan coverage based on your current employment or spouses, and the company has 20 or more, your group health plan pays first. So you're all good. Your group health pays first. You can pick up A if you want to. You can delay Part B, no problem. However, if you're 65 or older, you have group health plan coverage based on you or your spouse's current employment, but the employer has fewer than 20, and there's no exception, there's no pro service, there's no outrust. Medicare pays first. Medicare pays first. A lot of people just like, what? But Medicare pays first. And then there's other, scenarios there where Medicare will pay first or your employer plan. But a lot of people who are aging into Medicare have no idea that they even need to know that. Like, what? Who pays first? Because when you have a commercial plan, that doesn't come up. Okay. If you're required to enroll into original Medicare, should you keep your employer plan? So this person called me yesterday who said she knew she was supposed to sign up, but she didn't. Then she got a cancer diagnosis, so now she's gotta get on the ball. But anyway, she said, my employer is paying $3,000 for the health insurance for me and my husband. Our husband's on her plan. She said, I know that because I take care of that stuff. He writes a check to the insurance company. And she said, so I would think that that plan has to be better than Medicare. That's why I never signed up. But I said, well, your employer will be paying $3,000 and that insurance will only pay after Medicare. Very little to pay after Medicare, 20% on the Part B and, deductible on the Part A and some co-pays. So she's gonna consider talking to him. He's on vacation right now. But if you're required to enroll due to employer size, Medicare will pay claims first. Your employer coverage could be $5,000, still Medicare is gonna pay first. The employer-sponsored plan pays after Medicare. So it's your choice to keep Medicare and the employer coverage, even though Medicare is primary and the employer plan is secondary. But sometimes it makes sense to go to your employer coverage. Now, when you are working and you first move over to Medicare, it's very important to call the Benefits Coordination and Recovery Center. This is for people over 65. People under 65, I don't see it so much. But who ever heard of Benefits Coordination and Recovery Center? And I know the number by heart, 1-855-798-2627. Anyway, I call it a lot for people. But this is a number, and this is Eastern time. So in Hawaii, we got a call before 2 o'clock. But many times what happens, Medicare will show that you have your employer coverage. Even though you left, even though you retired, now you have a Medicare option. So when you go to pick up your medication, you go to the doctor, there'll be somebody asking you, well, who's primary? And how would you know? I don't know. Medicare is primary. And Medicare says, nope, the employer is primary. So the only way to fix it, I know it's hard to believe, you must call this number. If you don't call this number, you will be paying or you will be getting billed and your provider won't be getting paid until this is settled. So you have to let Medicare know that you now left your employer plan and you only have Medicare. They'll update the record, and from that point on, claims will be handled a lot more smoothly and seamless. Okay. So pay points. Some people 65 or older, these are all my cases, become ill while working. They lose their job and health insurance. Family and friends are uncertain about the steps to obtain coverage for them with no authorization on file. A family member or friend cannot even get information. So we have people, social workers at Queens Hospital, and they have me on speed dial, right, Elliot? And they have had situations, I'll tell you a situation. A gentleman was on family medical leave, 90 days were up, they said, hey, are you coming back to work? No, had something, he wasn't gonna be able to return to work. So the company said, oh, wow, okay, we're sorry to hear that. We'll, keep you in our thoughts. By the way, your insurance is ending the last day of the month, which was like 4 days away. And so the Queens folks called, they said, we have to release this guy, but he needs radiation. And without Part B, he doesn't have his Part B. She said, we usually schedule a radiation before they leave the hospital. She said, but with no Part B, we can't even schedule it. So can you help? So I said to my son, Elliot, can you run these forms over to the hospital? So Elliot ran the forms over to the hospital. The gentleman wanted to receive Elliot, even though he was in bad shape. I never met him, but he did. But he signed up the forms. I said, Elliot, can you shoot these over to Social Security? So Elliot had to go to Social Security, drop off the forms, and God was looking out for us because that gentleman was able to get the Medicare for the first of the following month. He was released, and then he was able to get his radiation. Without that, the social workers told us this gentleman would have perished. And he called us 6 months later to tell us how well he was doing. And when you went to see him, he didn't look like he was gonna make it. Because imagine finding out you lost your job, you lost your health insurance, and you need radiation. I mean, like the triple, I was just awful news, but we were so happy to do that for him. So the reason I put that other slide up about we have to become social workers and caregivers, because you might have to do this for somebody. So it's important to know. If you decide to replace your employer plan, you need to apply for Medicare coverage through a private insurance company. Medicare plans are based on your zip code. So if you have a cousin or friend on the neighbor island, and you're telling them about your great zero plan, that plan may not be zero for them. Because it's based on your zip code, what plans are available. There's 7 companies, I think 8, that offer plans in Hawaii: Aloha Care, Akamai Advantage, AARP, United Healthcare, Devoted, Humana, Kaiser, and WellCare. Plan options vary by insurance company. Not all zero plans are alike, so if you're looking at zero plans, go line by line and look at all the benefits, make sure you didn't miss anything. So what are your Medicare options? A and B with the standalone drug, A, B with a Medigap plan, that's the one that covers the gaps, and a Part D. Part C plans, it either can be an HMO or PPO, and if offered, some people have retiree Medicare plan options. It's very important if you go with a Part C Medicare Advantage plan, pay attention if it's an HMO or PPO. HMO, Health Maintenance Organization, PPO, Preferred Provider Organization. Had a person call me from New Jersey. Her mom lived in, her mom lived in New Jersey. She lived in another state about 1,000 miles away. Her mother gets rushed to the hospital. She's there for a couple days and it's time to go to skilled nursing. So the daughter gets a call from the hospital and they go, we need to transport your mother. Which skilled nursing facility do you want her to go to? So the daughter says, oh, I don't know about New Jersey facilities, just give the one on the top of the list. So they sent her there. The daughter gets to the skilled nursing facility to see her mom. And the first thing they say is, we need $5,000. And she says, why do you need $5,000? My mother has insurance. And they said, your mother has an HMO and we are not in network. So she had to get her mother out of that skilled nursing into another one, but she had to pay a couple of days. I think it was around $1,500, because even if a person needs the care, HMO has a network. You only go to the network unless it's an emergency. Needing to go to a skilled nursing is not an emergency. So the daughter had to pay that. So that's why, to me, people need to learn about this stuff. If employer coverage ends after 65, you need to choose a Medicare option to avoid gaps. There's something called COBRA. COBRA is the insurance that's offered to people if they lose their job. You pay the full amount of the insurance plus an administrative fee, but you'll get your dental, your vision, everything. However, if you're 65, remember who's primary when you lose employer coverage? Medicare. So some people have gone on COBRA only to find out they had to go onto the Medicare A, B, and pick a replacement. They needed time. They were just trying to get their head together about, I've been furloughed, this or that and the other. So I saved a couple people from this. I had one gentleman, he was the CFO in a company, he got furloughed, and he said, Martha, my daughter keeps telling me to call you, but I'm here and I'm here with my HR director. And she said, I can get COBRA and I'm writing out a check right now for $1,700. I'm about to put it in the mail, but he said, it just kept bothering me. I just want to be able to tell my daughter, I called your friend. So I said, oh, well, sir, how old are you? So he said, 72. I said, oh, well, sir, I understand you're furloughed and the insurance is going away, but you need to get your Medicare Part A and B, you and your spouse. And COBRA is not going to cover you because you don't have the A and B. So you can pay the $1,700 and it will be absolutely no good. It will not cover anything. And the HR person was like, she didn't know that. She never stopped to think. We tell everybody you have COBRA because they're required by law to do that, but she wasn't thinking about his age. So he found out that, yep, it's good he didn't send that check because it would have been a total waste and you don't get a refund because you didn't know. So COBRA is not a replacement if you're over 65. You gotta go get that A and B. Coordination of Medicare insurance and employer group plans, no worries. If you do pick up your A and B because you're a small company, the Medicare will pay first and your employer plan will pay second. So that's pretty good. You'll have no out of pocket. There's other plans in our community. Some people are retirees of the federal government, so you have to know how the federal plan works with Medicare. Some people work city, state, county. You have to know how the city, state, or county plans work with Medicare, because all of these plans are different and have different rules and regulations and things that you need to do. Again, key in Medicare enrollment periods, I'm just going to go over them very briefly. The initial enrollment period is when you first turn 65. If you will no longer have employer coverage and you need to enroll, it's 3 months before you turn 65. the month you turn 65 and up to 3 months after. But if you do it 3 months after, you're gonna have a gap, but that's the initial enrollment period. General enrollment period, that's for people who missed the initial enrollment period. They can only enroll between January 1st and March 31st of each year. And if they have been without Medicare Part B coverage from age 65 and they had no other insurance that they're supposed to have, then they will have a lifetime penalty that is equivalent to 10% of the Part B premium for lifetime penalty. Special enrollment period, that's triggered by certain life events. If you move, I have somebody just moved up to Washington State. If you lose your employer coverage, you have a couple of months to go ahead and request a special enrollment period, no penalties. So you have to know that that exists. Annual election period, that's the Medicare, that's the commercials are all about that Medicare period. The Medicare Advantage open enrollment period, agents are not allowed to talk about it at all. That is a period of time, this is just for education, January 1st to March 31st of each year. And it allows people who picked up a plan between October 15th and December 7th, they can change their plan, just this one little time through March 31st. Outside of that, you have to wait till the following October, and any plan you select will become effective January 1st of the following year. Under this open enrollment period, if you picked up a plan in the month of March, it would become effective April 1st. So that's what that is, okay? Again, January 1st to March 31st, crucial window, opportunity to switch from one Medicare Advantage plan to another. Changes become effective. Now, it doesn't mean you can switch from a drug plan to another drug plan. This is strictly for Medicare Advantage plans. Has nothing to do with the Medicare gap plans, strictly for Medicare Advantage. The enrollment periods I just talked about and the action required, initial, general, special, and annual enrollment period. So this stuff, there's a lot of moving parts to Medicare. Quickly, I just wanted to talk about the changes to the Part D for 2025. There's extra help available. That's for people with low income. They can get, help to lower the cost of their medications. 2025, there's also the lower insulin cost for beneficiaries. And this year, first time, Medicare has eliminated the donut hole for Part D plans, and there's a $2,000 cap on your prescription drugs. So if you have medications that are covered under your prescription drug plan, operative word is covered, you won't pay more than $2,000. I have a gentleman who takes a very expensive drug, it's called OPEV, and he pays, well, last year he paid $3,000 and then it was $0. But this year he pays $2,000. He can pick up that and any other meds $0 because that's the cap on prescription drugs. There's also let me say a layaway plan. There's also a Medicare prescription drug plan, a prescription payment plan this year. So it's a payment option to pick up your medications. So if you could not afford $2,000 all in a lump sum, beginning of the year, that can be paid, they actually will charge you over the remaining months of the year. So if you started in January, about $167 if you have medications that would reach the $2,000. So this is the first time that it's ever been around, and you got a couple calls, but we were told to direct people to the insurance company and let them fill out the application and get you onto the plan. So some people are enjoying some, instead of coming up with 2,000 at once, they can spread those payments out over the year. So that's good. I'm not gonna go through what Medicare beneficiaries ask me because there's a couple people here and you can ask me directly. So do you have any questions?
Okay, for those that are online on Zoom, there is a Q&A function that you can use to input your question, and then I'll read it out loud for Martha to answer. It looks like we got one. Okay, if a couple files taxes jointly, does the combined income count for the Part B monthly premium amount if only one spouse is going on Medicare and the other is not yet? 65.
Yeah, so the question is, I believe, is about higher income beneficiaries pay more. So they have a schedule of what the additional is called income related monthly adjustment amount. So they have a schedule for married filing jointly. There's also one for married filing separately, but yes, they do look at the joint income, the modified adjusted gross income for a couple, even if only one couple is picking up the Part B. So yes, they look at the joint income. Okay. So here's some numbers. The Social Security office, Honolulu, you always want to reach out to the office closest to where you live. Honolulu office is 1-855-572-4879. If you live closer to Kapolei, you can reach them at 1-855-572-4866. I love the Kapolei folks over there. They do a really, really good job. They've really helped some people who were in some dire straits and needed that Part B right away. And you can't walk into their office and get the Part B, but they were able to escalate the paperwork and get that done. Okay. I have another.
Yeah, there you go.
All right. I have a radio show. It's syndicated in the West Coast, the East Coast, but also you can hear it locally. You can listen live by going to their website and streaming it. But I'm on Sundays at 9:30 to 10 on KHNR 690 AM and 94.3 FM. I also have a digital app that's free that you can actually find my radio show and listen to it on demand. My app is called My Digital Health Buddy app. Again, it's Zero. It's a place where you can put your insurance cards. You can access my chart that has all of your medical information, your coupons, your care team, and then My Health Radio where you can use my shows. This is an app that I built. I decided to go back to college. I got my business degree from New York University many, many months ago. And now that I'm in the healthcare space, I wanted to be certified in public health. I didn't need to be, but I wanted to be. But this was my final project. And what my final project was people have a hard time keeping track of all of their medications, their insurance cards, and also for family members. So this is a place you can keep it on your smartphone. I didn't monetize it. There's no ads that are going to be playing. I don't even know people if they sign up for it, but many people have used it and found it very helpful. And also they can listen to my radio programs on demand, you know, all for zero. And then that keeps them up to date on, you know, what I'm talking about in the space. But I got an A. As a matter of fact, I got a 4.0, darling. My son's getting his master's in May from HPU, but I did New York University where I got my first degree from, and I was an honor student. I'm sure you will be too. Well, that is the end of my presentation. I hope that I didn't put anybody to sleep and you enjoyed it, but I love Medicare, and a lot of folks from this presentation that I've done before, they call me and they'll say, oh, I went to the seminar 5 years ago. I was like, wow, you kept my number? And they talk to me, and I'm always happy to talk to them, and they really appreciate it. And some of them, Gil, have told me that they would even call you to tell you that they're happy that you introduced us. And I know you have other people who talk about this topic, but I'm the person that comes that doesn't sell anybody anything. I'm really here to help answer questions and really give people everything that I know about Medicare that I think will make the journey seamless for you. And I love being your Medicare buddy. So thank you.
Yeah. All right, if there's any questions in the room, you can ask Martha now, or if there's any on Zoom, just use the Q&A function. If not, yeah, if there are no questions, yes.
Oh, please.
Yeah.
Yeah, we have
Yeah.
time left.
Thank you very much for attending this very interesting seminar. There's always a question out there. I just want to make a comment about my dealings with Martha. I met her because I was curious about her license plate. And as a result of the discussion of the license plate, I found out what she does for a living. I can tell you, as a matter of fact, that whenever I have questions with Medicare or with Social Security, Medicare especially, because my practice, Martha has been able to answer the questions without any difficulty. She has solved a bunch of my issues that have resulted as a result of deals with personal injury and tort law. So I really suggest that, if you're interested in calling her about Medicare and also about your practices, I'm not sure how many of you still do, personal injury. She's a wealth of information, so thank you again very much, Martha. It's nice to have you. If anybody else has questions at this time, I suggest that you contact her, but she is a wealth of information and I appreciate her volunteering to present today.
Thank you. Oh, yeah. I just want to thank you all for tuning in today. And if you want to get a hold of me, I give out my personal cell phone number. I thought it was up there, but I don't see it. So it's 808-230-3379, or reach out to Gil. He'll give you my number. Aloha.
All right, thank you, everyone.
Hey, Martha, I just wanted to tell you,